Hello and welcome to the first video in this series. I'm Martin Eddy and I own the Jade Herbalist. In this video series we will talk about the herbal medicine consultation, the herbs, and to start with in this video I will introduce myself and how I became a medical herbalist. So I became a medical herbalist in 2018 when I graduated from the University of Lincoln on their herbal medicine program. If anybody is interested in becoming a herbalist, just send me an email and I will signpost you to the right areas. So how did I get into herbal medicine? I get asked that question quite a lot because I do have a background as a pharmacy technician working for the NHS. I've worked for the NHS and I still do for over a decade, and a lot of people find that difficult to process, that I work in conventional medicine and herbal medicine. I'll get into why later on. So I became a herbalist after being ill for a period of time. Now, the doctors assumed that I was suffering from depression, and I wasn't suffering from depression. They tried to give me citalopram, which, because I wasn't suffering from depression, didn't help me. What I was suffering from was being lost, and there is a distinct difference for me. This is no disrespect to any doctors out there. It's simply that I recognised something in myself which they didn't see, and I looked into herbal medicine. I remember quite distinctly I was sat on my friend's sofa and we had this little group. There was 3 of us and we did something called Wellbeing Wednesdays. And in that, it was a Wednesday afternoon and evening. We would do things that aided in our well-being, because all 3 of us were ill in some way. And that usually would involve having nice food, having a chat, seeing if we could support one another in any way. It was an exercise in social prescribing that we'd done for ourselves. I digress. So I was sat there on her sofa and we were looking at different things, and then the course came up. And my friend said to me, "Why don't you apply for that course? Because you would probably really enjoy it." So I did. And then here I am now as the Jade Herbalist. It was the best 3 years of my life. I made some amazing friends and colleagues along the way. And I hope now to talk to you a little bit about herbal medicine. So, what is herbal medicine? That is a question that I get asked quite frequently, and it's usually by family members because they don't understand what I do. So, herbal medicine it's just medicine. Because of my background, I don't actually differentiate between the two. Both are just medicine to me. Conventional medicine has its background in plants, just as plants are used in conjunction with and instead of regular medicines. In my eyes, there is a place for everything in this world, and there is a place for conventional medicine and there is a place for herbal medicine. And quite often than not, there is a place for both together. Because of my background working as a pharmacy technician, I'm able to help with the integration process of putting the two together. I'll talk a little bit more about integration of medicines. I'll touch on it a little later in this video, and if there is interest in it, I will do a separate video on integrative medicine. So, herbal medicine has many forms, and it's all plant-based. I do subscribe to some Eastern philosophies as well. However, I don't use the animal product side for two reasons. One, I don't know anything about it to be able to use it. I'm not qualified in it. And secondly, it is illegal in this country. It works for them, it doesn't work for us, so I don't look at it, to be perfectly honest with you. So there are two philosophies that I go by. There's the Western philosophy of herbal medicine and the Eastern philosophy of herbal medicine. Now, the Western philosophy is based on a learned system that started, debatable where it started, but it's ascribed to Greece. And the Eastern philosophy has its roots in ancient China. Now, the Eastern philosophy is much more robust and has been studied a lot more, and its theory is more in depth. That doesn't mean that the Western theory is lacking, it just means that there are two different approaches. Both are based on the theory of energetics. Energetics is simply the way we prescribe for different people. An example of this would be if someone comes to me with a heart problem, for example, if they have high blood pressure. They can have high blood pressure for a number of reasons. I'm not going to give them the first high blood pressure medicine that I can think of, because it might not be suited to them. Their personality and their energy might not suit that plant, so I'll pick another one. So in essence, energetics is simply picking the right herb from the scientific categories for that person. There is nothing esoteric about it. It's simply a way of giving the patient what is best for them. Now, Chinese philosophy is a bit more in depth than that because they practice on a different system. I don't use their full system. I use parts of it, and I've integrated it into the Western system. This is something that a late mentor taught me, and many herbalists that qualified from Lincoln are adepts in doing. Herbal medicine isn't a cure for everything. In fact, legally, we're not allowed to tell you we can cure anything. That rule also applies to doctors and nurses and dentists. Any health professional is not allowed to tell you they can cure anything. What I can tell you is that we aim to alleviate the illnesses that are stopping you in your life. Now, in some cases, it could mean remission from that illness, and in other cases it means that we relieve the symptoms enough to improve your quality of life. Quality of life is quite important to me, and it is through my journey as a healthcare worker and becoming ill and then becoming a herbalist that I've realised that our quality of life as we know it is not accountable for what we need. So by that I mean the Western way of living is not sustainable for longevity. And this is where I bring in some Eastern philosophies, because the Eastern philosophies have studied longevity much more than we have, and it's through their wisdom that I aim to meld a treatment plan that gives you a synchronicity in your life that you're able to move forward. We do this through the consultation process. I prefer to think of the consultation process as a conversation. I will be taking notes throughout this conversation, and these notes are simply what you're telling me in either shorthand form or in a language that I would understand. There is nothing in them that I'm not willing to share with you as the client. It's simply notes that I take, so when I meditate upon your case and give you a medicine, I have a basis and a framework to work off. Your notes I will always store, and they are stored securely. If you ever wanted a copy of them, you just have to request, and I can scan them in, and I can email them over to you. So the consultation process. The consultation takes about an hour. If it's your first consultation, I do a little bit longer, simply because if your case is quite complex or there is a lot we need to discuss, it gives us that extra breathing room just so there isn't a pressure upon you. Now, you may be used to a consultation with your GP which lasts between 6 and 10 minutes. My hat's off to GPs. I don't know how they can take a case and diagnose within that short space of time. I know they're under considerable amounts of pressure, and I can't thank you enough for how you help people. However, within herbal medicine and within my consultations, we take it a little bit slower. That's so no stone gets left unturned, and I get to know you as a person. And it is me getting to know you which is actually very important for the herbs that I will pick for you. As we touched upon energetics earlier, it helps me form a basis for what herbs would be best in your medicine. As part of the consultation process, we will discuss your primary case. So this is what you've come to see me about, and we will have a dialogue about this. And one of the most important factors is I will ask you how you feel about your illness or the part of your life that you're in that's made you come to see me, because your answer will help form the basis for the medicine. And it is a simple question. I will just ask, how are you feeling about this? For example, if you have high blood pressure, I will say, how do you feel about your high blood pressure? Do you have any kind of emotion about it? And if you say to me, I'm indifferent, that will tell me a lot about you and your health and how you approach your own well-being. If you're worried, that will also inform me of, one, a contributing factor, because worry can raise your blood pressure, and two, it also tells me that you are ready to engage on a serious level. That's not to say if you're feeling indifferent, you're not feeling serious about it. It informs me of the energetics that need to go into your medicine. I will also ask you about your diet and lifestyle. Now, a part of the lifestyle is I will ask you about recreational drug use. Now, I'm not going to inform the police about any drugs you take. My philosophy is live and let live. I don't condone the way drugs are handled by what we would call criminal class, and the way society reacts to them, drugs that is. However, if you choose to make them a part of your life, that is your choice. The reason I'd need to know about drug use is, firstly, if you're taking cannabis, for example, it will tell me what energetics and what herbs are already in your life. Secondly, it can also help me with interactions. For example, if you tell me, oh yes, you regularly take cocaine and you have high blood pressure, it will tell me that I need to have a conversation with you about what cocaine can do for you, and maybe help you on your recovery process. I will also ask you things like how much coffee you drink or tea, how much water, and then I will. It's a very open question, but I will ask you about your average diet. I don't mean list me everything you've ever eaten. It will just be a typical day. What do you have for breakfast, lunch, and one of the evening meals that you usually have in the week. Everybody usually has the same variations of different meals, so I'm not asking you to list me an entire menu. Next, we will go through each of your body systems, and we will be discussing them in as little or as much detail as you'd like to go into. I will always ask you about digestion, because digestion is very important, and it will also give me an insight into the inner workings of your body. And for example, if we move on to talking about your breathing and your lungs, and you say, actually, I don't have any issues with my lungs, I will probably just ask you a few basic questions just to make sure there's nothing underlying there that you're not aware of, and we'll move on. It's the same for other body systems. If you say, no, there's no problem there, I won't spend valuable time digging into something that's not a problem. At the end of the consultation, I will take your pulse and blood pressure. I do this for a few reasons. The first reason is I use something called the cardiovascular index, and that helps me decide what medicines are right for you. And secondly, it gives me an insight into your cardiovascular health. It's a very short test, and it's relatively pain-free. I'd actually say completely, unless the tightness of the cuff you find uncomfortable. If you would like a record of your blood pressures, I can gladly give you those. I'm in the process of creating a little form that we can just record your blood pressure every time I take it, and that way if you ever need to see your GP, or if you have any heart problems, you can pop along to your consultant. You say, actually, I've been having my blood pressure taken regularly, this is what they are. As part of my degree, we learn clinical skills, so I am able to do a whole range of tests. They have to be face-to-face, however. The second thing I will do is I will ask to look at your tongue. Now, this is because I ascribe to Eastern philosophies, and I practice tongue diagnosis. A lot of people look at me strange when I talk about tongue diagnosis. Now, tongue diagnosis isn't a mystical art. Anybody can learn tongue diagnosis. It's actually a fascinating subject. And if anybody wishes to learn about it and would like me to make a video on tongue diagnosis, I would happily do so. Tongue diagnosis to me is quite important, and I will ask every single person at every single consultation so I can see their tongue. And a lot of people think, you're asking me to stick your tongue out at you, and that's rude. They feel silly, but don't feel silly at all. Whilst I was learning tongue diagnosis, I stuck my tongue out at everybody, and vice versa, they stuck their tongue out at me. The tongue is important because it's the only internal organ we are able to physically see. And by seeing it, we can see what's happening inside the body. And you think, how is that possible? Well, it's a part of your digestive tract, and it is one of the first things that your food touches. It's the thing that your breath touches. It's got blood vessels in. It's quite important. And by seeing your tongue, I can see it's like a mirror of what's happening inside the body. For example, if you have a lot of stagnation, which is a Chinese medicine term, it will show on your tongue. If you have heart problems, it will show on your tongue. If you have anxiety problems, it will show on your tongue. And by seeing your tongue, I can get a snapshot of your well-being. Now, on occasion, if I'm looking to monitor the way your tongue changes, I may ask if I can take a photograph, and the photograph will be just kept with your note. It's completely confidential, and that will then allow me to look back on what your tongue looked like before you took your medicine, and I can also show you the progression you've been taking. Now, one of the first things people do before a consultation, when they know they're going to be sticking their tongue out at me, is they clean their tongue. I'm going to ask you, don't bother. The most I'm going to ask you to do is just have a drink of water. Simply, if you've just eaten lunch or something like that, it just helps clean the palate and I get a better look. Just act like it's a normal day. Sorry, my glasses are slipping down. Now, after the consultation is finished, I will meditate upon your case, and then I will decide on what to put in your medicine. Now, medicines come in several different forms, and I will pick which one is best suited to you. 9 times out of 10 I will just choose a tincture, mainly because I stock more of them and then they have a longer shelf life, so I'm able to have a wider variety. Secondly, they're easier to take. You just pour 5 ml into a cup, or 7.5 ml, depending on what dose I decide for you, and you take that 2 or 3 times a day. It is an alcohol extract, but don't worry, it's only a small quantity of alcohol, so you won't need to worry about drink driving, etc. If you are worried, I would just ask you to measure your tincture out to the required dose and pour it into a cup of boiling water and just let that cool, and by the time it's cooled, the alcohol would have burned off. So in essence, you would have an instant tea. I do sometimes prescribe teas. I don't prescribe them very often. That's because I don't really have the space to store hundreds of different bags of tea. A single bag of tea for one herb can be a bag about this tall, and I currently dispense out of my home, so it's a space-saving exercise really. However, if you are a patient that needs tea, I will just order them in for you. It's the same with powders. You will see some powders used. I don't use them very often, mainly because they do have a short shelf life. Their shelf life is only about a year, and they do come in big bags. And I would then have to either encapsulate them, which takes a long time to do, or you would then have to mix it in with yogurt and have it with your food. They're not for everybody, and I have about 5 in stock at the moment. One of them is fennel, which I don't really use for patients, I just use it for cooking. So if you do require different medicines, just tell me. For example, if you're a recovering alcoholic, tell me please, and I will prescribe you teas. Teas are very nice. I love teas. I'll just buy the herbs in for you, and it is for this reason I only dispense on a Wednesday afternoon. So you'll have your consultation on any given day, and I will dispense on the next Wednesday. This gives me time to meditate on your prescription. It also gives me time to get stock in if you require something special. All of my medicines that I prescribe are tailor-made just for you. No 2 tincture mixers or tea mixers are the same. They are crafted especially for the patient. It's not like you go to your chemist and you get a box of pills, you pop a pill. That pill was made in a batch of hundreds of thousands. Your tincture is made in a batch of 1. It is just for you. I will post your prescription out to you. It's usually by Royal Mail, and it will arrive with you within a couple of days afterwards. If you would like to collect from the Riverside Health Centre, if that's where I see you, I will text you next time I'm there, and we can arrange you picking it up. If after we've had a few consultations you wanted to collect from my residence, I live in Arnold, that is also something we can arrange. Now I'm going to talk a little bit about herbs, and since we've just talked about a few different forms of herbs, I'll talk about one that I've just photographed for you. So on your screen you should be seeing 3 containers, one containing some dried herb, which is a root that's been processed and cut up. The second would be a powder, and the third, in the little measuring cup, which is what you'll be getting for your tinctures, is a tincture. Now all 3 of those are actually the same herb in different forms, and that herb is Siberian ginseng. It is one of my favourite herbs, and it is actually one of the few herbs that is in both Western herbal medicine and in Eastern herbal medicine. Now this herb is known as an adaptogen, which is a tonic herb, and it is used for helping to build up stamina. I use this for people who are tired and a little worn out and in need of a little pick-me-up. The way it works is over time, and this is why it is one of my favourites, because you don't go from like down here to up here overnight. It's more of a gradual curve, which I think the patients benefit from more because their bodies have time to adjust. In Chinese medicine, it is used as a tonic, and it is used for replenishing the qi, which in Western herbs it is used for the same purpose, we just call it something different. Now you've probably heard of Siberian ginseng or just ginseng before. There are several different types. This one is just one of my favourites. It's readily available in many health food stores. However, I use it in a more concentrated tincture form for your mixers and for your teas. It has a slightly sweet and woody taste. It's actually not unpleasant. It's one of my favourite teas to drink. As it's an adaptogenic herb, I use it especially in the summer, because I get summer exhaustion quite easily. So I would drink the tea in the summer to help pick me up. I don't deal with heat very well, and it is quite a cooling drink. It's one of the herbs that I can give you in larger quantities as well, being an adaptogen. So if you needed a little bit more help, I can put a bit more in for you. Other herbs that I use, I'll give you an example of a respiratory herb. Now respiratory conditions have many different forms. So you've got things like asthma, you've got bronchial coughs, COPD, you can have a nervous cough, you can have a wheeze. A lot of the herbs that we use actually treat all of them at the same time. And one such herb is elderberry. Now elderberry I use in a mix that I do. This is one of the few that I batch make together, and that is for seasonal coughs and colds. It's for an acute mix, and I mix it together with a little bit of ginger and some echinacea, and that's just a pick-me-up that you take a little bit of every day to get you through the winter season or winter flu season. It works by boosting the respiratory system and opening up the airways. Again, this is one of my herbs that I use, or mixes that I would do for what I call an acute consultation, which is generally a 15 to 20 minute consultation, and I can give you a ready mix bottle for it. If you just let me know beforehand that this is what you're coming to see me with, I'll bring one just in case it's suitable for you and you can walk away with it the same day. I do the similar sort of thing with digestive aids. If you need a digestive aid, if your stomach is feeling sluggish or you're finding yourself a little bit bunged up, book a short consultation with me, and I can bring some of the drops along. With digestion, you don't actually need much medicine. Digestion works on taste and on pharmacological actions. The taste is actually one of the more important things. I use bitters a lot, and this stems from scientific evidence of Swedish bitters, which is used in Eastern Germany and Eastern Europe and in Northern Europe. And these are bitter herbs that you take a small amount of after each meal, and it just aids in the digestive process. I'm a firm believer in bitters, and if you feel that they could benefit you, just contact me and we can arrange a small consultation, and you can pick them up from one of the locations, or I can post them out to you. Other herbs that I use. So one of my favourites is hawthorn. Now hawthorn is one of those plants in which I can actually use all parts of it. So I would use the leaf, the flower and the berry. And predominantly it is a cardioprotective drug, so it helps protect the heart. I will use it energetically for those who have a heavy heart and are locked a lot inside. However, I would also use it for those who are at risk of cardiac conditions. You can get those conditions, but that's usually from working out too much. This herb, it's quite sweet, but it's also quite cooling. So I would use it for the people that are feeling a little bit intense, their blood pressure might be a bit high, they might be getting palpitations. It's useful for anxiety as a secondary herb. It all gets put together as one. I actually use all three parts in one. I find that you get better benefit from using the plant as a whole than its individual components. It's one of the few cases, to use the old adage, that the sum is more than its parts. Now Crataegus berries are common. Hawthorn is Crataegus levigata in Latin. The berries are actually in season late summer, and you'll find them in hedgerows across England and probably in Ireland as well. I don't quite know if they're in Ireland. It's of the rose family, and you'll see these small red berries, and they are edible. Now, if you are someone who likes to forage, you'll probably know that you can make some lovely jams out of them. You can dry them for tea. They are very tasty. Don't go out there and just take some random red berries. There's also other berries that are in season at that time, which are red, which you can't eat. An example would be the rowan berry. You don't want to be eating that off a tree. Hawthorn does actually have a tree, but it's also a shrub. So if you are interested in foraging for your own hawthorn berries, I can signpost you to a herbalist that does herb walks, and they can introduce you to the plants. Locally there are a few that do herb walks. It's not my strongest point, so I will just signpost you over to them. So other plants that I love to use, nettle is one of them. That raises a few eyebrows. Nettle, when it's in a herb, is not stinging at all. Once it's been processed, the stinging part, which is the formic acid, is no longer there, and it is one I use for its restorative properties. By restorative, I mean its nutritional value as well as its energetic values. So nettle has a lot of antioxidants, and it's also high in minerals such as iron. And if, for example, you are a female who is having menstrual problems, I will probably give you supplemental nettle just to help boost your iron levels. Nettle is one of the few teas that I do stock because it's better as a tea for that purpose. Nettle again is actually another one of those plants where I can use multiple parts of it. I actually do stock the root, the leaf and the seed. Each of them has its own use. So I would give the root, for example, to men, just because it can help with testosterone levels, as does the seed. Now the seed can help with energy because it is quite a stimulating herb. It's not suited to everybody. I find that men are preferred for the seed, just as there are herbs like shatavari and vitex, which I would only really use in women's cases. This is actually a part of the energetics of herbs. So the energetics can be masculine or feminine, or it can be gender neutral. Now, without getting into the concept of gender, it's just the way I identify different herbs for different categories. So for example, iris is what I would categorize as a feminine herb, but I would use it for both men and women. It's just the qualities of the herb that I'm looking for and the way I've categorized it in my prescribing. Other energetics that I might use come from Chinese philosophy, and that touches upon things like stagnation, which is generally that you need to get moving in your life, and that is reflecting in your health because there is a blockage within your vital systems. So this is where we get into, it's slightly esoteric prescribing. However, it will also be a part of scientific prescribing. I factor both in at the same time. Now, I notice we're coming up to about 25 minutes. I don't want to bog you down with too many herbs because I can talk about herbs for hours, and all the different herbs I've tried and all the different herbs I use. If you have any questions, comments, please feel free to drop a comment down below, or you can email me at info@jadeherbalist.co.uk, or you can send me a private message over Facebook. It will come through to the page. I usually will see all the messages at night. If it's during the day when I could be either in a consultation or if I'm at the hospital, I may not be able to reply straight away, but I will try to as soon as possible. If anyone is interested in booking a consultation with me, you can do so at jadeherbalist.co.uk. You can find out more information about my practices, my methodologies and the way I prescribe over on the website. It is a work in progress and I update it quite regularly. News for the future, and in my next segment is going to be how I put meditation into my prescribing, and it's something that I want to talk to you about at great length. So that will be my next video. So until then, I hope you have a pleasant day, and I will chat to you again soon.